A lot is going on about COVID.
Yes.
And this is a new disease that people don't know so much about. And when it comes to health policies, we would like to know, why is our government and the rest of the countries responding the way they are? What are the issues within policy that affect the health sector in general? And how do we fit in with the other conditions that affect us as a population? And how do we come in? What role do we play? It is actually guided by the policies that are in place. And we would also want to know the health policies that are in place. How are they affected in terms of responding to COVID-19? How have we modified them? How have we made sure that we can use the policies that we have in place? Remember, this is an emergency. It is not that we are going to develop new policies. We already have health policies in place. How can we use them to be able to respond effectively to this particular pandemic? I'd like all of us to remember that the WHO actually set out on 30th of January to declare the COVID-19 outbreak a public health emergency of international concern. And with that, they needed to come up with a document very fast to enable the countries to be able to respond to this pandemic. And the document that they developed is under the name COVID-19 Strategic Preparedness and Response Plan.
Yes.
The objective of this document, which has given 8 guidelines that the WHO refers to as 8 priority pillars, is actually to stop human-to-human transmission, and also to be able to provide care, appropriate care, to those who are actually identified to be COVID-19 positive. Now, to go straight to the 8 pillars, yeah, the first one is country-level coordination, planning, and monitoring. You realize that in a bid to respond appropriately to this pandemic, it has to be coordinated at a central point, and that is from the government level. WHO requires that each government, each country puts in place COVID-19 emergency response team, which our government also put in place. And I'd like to come back to Mmust'S. You'll find that the COVID-19 activities are also well coordinated. When the university was suspended its activities, they actually put in place a COVID-19 emergency response team. And this is actually guided by this first pillar that has been put in place by WHO. And with regard to the same, the pillar specifies that the activities in response to COVID-19 should be coordinated. It should not be haphazard. It should be coordinated. And when you look at our country, for example, we get daily briefs from the government, and it is from one central point from the Ministry of Health, isn't it? So that we have information that is uniform. We don't have everybody going out and saying this is what we have today. And even the testing for COVID-19 is coordinated from the ministry. That is basically what it entails in this particular pillar. And it is a very, very important pillar, because if we are not responding in a coordinated way, then we are going to lose it. We're actually going to lose it.
So far, what are your thoughts on the coordination? Have we done exactly what WHO recommended? Are we in the right track?
I must say we have done well. We have done very well. And you can see this from the daily briefs that we get from the ministry. They're able to tell us what is happening. They're able to tell us, in this particular area, we are considering this a hotspot because the numbers are going up. And this is all very coordinated. I must say I'm happy with what is happening.
That is good.
In terms of coordination. The second one is risk communication and community engagement. This is very important. What this particular pillar means is that we need to communicate critical information on COVID-19. People don't know a lot of information, and there's a lot of rumors, there's a lot of misconception, and you'll realize that if people don't have the right information, even whatever response you require from them will not be appropriate.
True.
So with this particular pillar, the governments are required to tell the community, to tell the people what is known about COVID-19, what is unknown, what is being done, and what actions are to be taken on a regular basis. And this is happening both at the country level and even within the counties, within the county COVID-19 response teams. And the third pillar is surveillance, rapid response, and case investigation. This particular pillar requires a lot of monitoring to be done. It requires that we have response teams put in place. It requires that we do testing. And you'll realize initially the government was only able to do few testings in a day because of the capacity. But this has actually been scaled up. People have been trained, more labs have been opened, even within counties, so that we can actually scale up the testing. I'd like to refer to what the Director General of WHO said some time back. He said, we are fighting a virus, and we can only fight this virus if we know where it is. We need to scale up testing. We need to be able to identify the population that is infected by this virus. So the testing so far has been actually scaled up, although there are challenges here and there. The other day, the CS of Health was saying they were having a backlog of the test results because they were running short of the testing equipment. But they are doing very well. Kile ningeweza kuongezea kwa yale ambayo umesema ni kuwa hiyo ni changamoto na imetokana na vile hapo mbeleni unakumbuka niliongea about communication. Ni mambo yapi ambayo wananchi wanaambiwa kuhusu COVID-19. Hapo mbeleni watu hawakuwa naelewa ni nini inaendelea. Na kulikuwa na wasiwasi mingi, watu walikuwa naogopa, wanasema nikipimwa, nikipatikana nitapelekwa quarantine. Na nitakaa huko kwa muda 14 days ama hata masiku zinaweza ongezeka. Hiyo ndio shida yenye ilitokea. Lakini natumai kuwa hiyo itabadilika kwa sababu kulingana na vile nimesema, WHO inatuambia tunaweza kupambana na hii virusi pale wakati tunaweza kupima watu na tujue wako wapi. Okay, the fourth one is points of entry management. Na hii it deals with the borders, the airport, and you'll find that what is required is that we need to scale up the management, the interventions that are put at this point. At the borders, there's a lot of movement. People move in and out. And if you do not strengthen the interventions that you put in place in response to this virus, then you're not able to control it. And you'll find that as a country, we shut the borders. And it is guided actually by this pillar. We shut the borders. And we have healthcare workers who have been trained on COVID-19 management who are stationed there. And you find that, for example, at the Busia border, we have the testing points, we have strategies put in place so that those who are tested, then they are put in isolation if they test positive, or they are put in the quarantine. And this pillar is very important for us to be able to, you can look at, for example, the lockdowns. So if you close your border, it's like you're locking down your country. And you are preventing the movement in and out of your country, and you are able to contain the spread of the infection. So in terms of the closure of the borders and the lockdowns, initially people didn't take it well. And going back to the second pillar on communication, I think the government has done a lot of communication to make people understand why they are doing it. And then when you look at the changes in terms of the numbers of the positive cases, though we are testing more, but you'll be able to see that the containment, the closure of the border, the lockdown of the counties that we consider the hotspots actually did help. Otherwise, we would have had a spread to the other counties, and it would have been at a very high rate.
That is true.
And I think at this particular point, people actually understand. And what I'd like to appreciate that the government did, they said we are going to stop the movement of people in and out. But the goods, food, are allowed to be transported. So I think that intervention actually made people to understand that this is for the good of everybody. Now the fifth one is the management of national laboratories. This still is in line with the testing. It is still in line with the ensuring that we are able to identify those who are positive within the population. And what WHO requires is that countries are able to train to ensure that they have capacity to test. Countries are able to procure whatever reagents they need to be able to test for COVID-19. And governments were being prepared because this pillar says that the testing, the numbers we are required to test will go up as the pandemic continues. So it is a pillar that actually prepares the government to be able to conduct testing. And as I had mentioned before, we can only be able to respond effectively if we are able to identify the people in the population who are infected by the virus. You'll find that initially we only had the National Influenza Laboratory in Nairobi and KEMRI that were able to test. But as time went by, in Coast we have KEMRI that is also able to test, and in Kisumu they are also able to test.
So a person from Kakamega can go to Kisumu for testing.
And there are strategies that have been put in place so that the sample can be taken and taken to those particular laboratories that are tested. The sixth one is infection prevention and control. You realize that COVID-19 has been categorized as a highly infectious respiratory infection. So that means that we need to put in place strategies to be able to ensure that the infection does not spread from one person to another, both in the health facilities and within the communities. A lot has been done within the facilities. Facilities here, I mean the health facilities, the hospitals. A lot has been done in terms of building capacity of the healthcare workers. Remember, this is a new disease, and people had to be retrained. People had to be given more information on how do you take care of yourself, how do you protect yourself, how do you protect the patient. And in the health facilities, you realize that they attend to everybody. I will walk into the emergency department. I may be COVID positive and nobody knows. The healthcare workers will interact with me. How do they prevent the transmission of infection from one person to another at that point? And then in the community also, a lot has been done. A lot of information has been shared by the community members on how to maintain both hand and respiratory hygiene. We are being told about hand washing. This has to go on a day-to-day basis. We need to wash our hands with soap and water. We need to sanitize. In terms of respiratory hygiene, if you are coughing, if you are sneezing, then we are being told you need to use a flexed hand or you need to use a handkerchief. Naweza sema kuwa hiyo information imefikia watu. Kwa sababu hata serikali imekuwa inatumia watu kama chief kwa mabaraza na watu kama village elders. Hiyo information imefika. Ile changamoto inaweza kuwa ni hao watu wenye wako kule chini kijijini wanaweza kuafford, wako na pesa yenye wanaweza tumia kununua hiyo barakoa. Wako na maji. Kuna miji mingi ambayo hayana what we call running water. Wako na maji, wako na sabuni na sanitizer. Lakini kile ningependa kuambia watu, kuwahimiza ni kuwa tujaribu tunawe mikono na maji na sabuni wakati wowote. Tujaribu wale wanaweza kupata sanitizer watumie. Tujaribu tutumie barakoa. Na utaona kuwa hapo mbeleni barakoa zilikuwa expensive. Nakumbuka nikinunua yangu ya kwanza niliuziwa 200. Na nilikuwa najiuliza hii 200 nikitumia alafu nitupe nitaweza? Lakini sasa unaweza pata barakoa hata kwa shilingi 30. Na serikali pia inasema si lazima utumie ile barakoa yenye tunaita surgical. Huku mjini mali you will not be in crowds. Unaweza kutumia barakoa yenye imetengenezwa na nguo.
Kweli.
Sasa ukinunua shilingi 30 unaweza kuiosha. Na hiyo nafikiri inaweza kusaidia. Case management ni pila ya 7. This one basically deals with the management of those who test positive. Which strategies have been put in place for managing those who test positive? Now, according to WHO, it prepared countries. It informed countries that initially you'll have few cases, but with time, the case numbers are going to increase. You need to put in place strategies to be able to manage those numbers. Na wakati huu ukiangalia hata katika nchi yetu already tumefika more than 5,000 cases, isn't it?
Yes.
Mbeleni tulikuwa na less than 100. Our 5,000 cases, where are they admitted? Do we have the isolation beds? Do we have the capacity to be able to take care of them? You remember on 6th of June when the president gave his presidential press message, he informed us sadly that we did not have the capacity in terms of the isolation beds. You remember we were being told in CIA we only have 10 beds.
Yes. And 9 had already been occupied. Yes.
And the president challenged the counties, and up to this week they were given up to this week to ensure that each county has a minimum of 300 beds. Now, with the case management, something else that is coming up is that as the numbers increase, what criteria do you use to determine who is admitted in that isolation bed and who is not admitted if the capacity is overwhelmed? Then you'll realize WHO is saying we need to give priority to those who have severe illnesses, to the elderly who have underlying conditions, in case you have to make a decision. So such that even as a country, you realize 2 weeks ago, we were informed that because somehow the numbers were going up, then we are going to consider home-based care of those who test positive.
Actually, hiyo ilikuwa swali langu lilikuwa lafuatia.
Home-based care of those who test positive but are asymptomatic, so that we can release the pressure in the healthcare system. In terms of home-based care, remember we are talking about those who are asymptomatic. These are those who test positive and are not actively showing symptoms. And according to the guidelines, there is a criteria that will be followed to ensure that someone meets it for them to be taken care of at home. This person is supposed actually to self-isolate in the house, so that you have a particular room for this person, and he stays there for the next 14 days. He does his things there. He's given food there. You minimize contact between this person and the rest of the family members, such that you identify just one person to be interacting with this person, so that you are able to prevent that transmission.
I think
the use of that criteria is important, particularly that a lot of questions have come up. What if we stay in a one room, the whole family? How do we deal with it? So that criteria has to be followed to be able to determine that you actually release this person to the community. The final pillar is on operation support and logistics. So you realize that responding to COVID-19 requires a lot of logistics in terms of human resource and equipment, what we call PPEs. Personal protective equipment. And you realize even from the beginning, even the Western countries, the developed countries, they were running short of the PPEs. So the WHO put in place this pillar to prepare countries to be able to acquire PPEs to be used in response to this COVID. And I must appreciate what the government has done. The government has tried to put in strategies so that this equipment, whatever we require to respond to it, are actually produced locally. That actually reduces the cost. It also reduces the time that we are able to acquire the equipment that we use, though there are still reports of shortages here and there in our healthcare facilities. Ningependa kuhimiza wananchi kama vile Minister Kagwe alisema hapo juzi, kupunguza uambukizi na ugonjwa inafaa kukuwa personal responsibility. Na ningependa kuhimiza wananchi niwaambie kuwa tusichukue kuwa maisha ni kama kawaida. Huu ugonjwa upo na tutaweza tu kupungua uambukizi kama tumefuatilia hiyo maagizo ya serikali. Nikiangalia kama ile directive, nitaangalia directive moja moja.
Yes.
Nikiangalia kama ile directive ya lockdown, ya kupunguza watu kuingia katika county zingine, utapata kuwa hiyo ilisaidia, ilipunguza maambukizi, na tunaweza kuona hiyo katika zile numbers zenye zinatangazwa kila siku. Hata hiyo social distancing na hata hiyo curfew ilisaidia. Ingekuwa kuwa hizi sera hazikuwa zimewekwa, basi hapo tungepata kuwa hizo numbers za wale ambao wako positive na corona ingekuwa juu kupita yenye tunaona sasa. Ningeanza na kuregelea vile nilikuwa nimesema hapo mbeleni, ni kuwa initially when the issue of putting the contacts in quarantine, the approach that was taken, I think, is what created fear among everybody else. Initially, I think there was miscommunication. There was no clear information on what is happening there, and there was also the aspect that when you're put on quarantine, you have to take care of the costs. So there was a lot of fear. But what I'd like to encourage the community members and everybody else is that they need to look at quarantine positively. Because if you have been in contact, kama umekuwa na uhusiano wa karibu na ule mwenye amepimwa na akapatikana ako na huu ugonjwa, then inafaa uwekwe mahali kwa muda, ili pia wewe upimwe within those 14 days, wahakikishe kuwa you are not actually infected kabla uachiliwe to the community. So kwa hivyo ninaweza sema watu wachukulie karantini positively. Na mbeleni hapo nilisema kuwa hii ugonjwa, it is highly infectious. Kumaanisha inasambaa kwa haraka kwenye jamii. Kwa hivyo kama kuna wale wenye wamehusiana karibu na wenye wako positive, for us to be able to protect everybody else, the general population, then we just have to look at quarantine positively. What I'd like to say is that to everybody else, they need to realize that the fight against COVID-19 requires efforts from everybody, and that includes the government, the different sectors, and even that is why we come in as an institution. When the county was assessed, it was realized that we could actually be able to host the people who are being put on quarantine. And this is our contribution as an institution towards the fight against COVID-19. And you realize yesterday when the CS of Education, Magoha, talked about the possible opening of schools in September. He did give directives that the quarantine centers that are outside the hospitals and actually education institutions, they need to review and check if they still have patients there. Then they need to be taken back to the health institutions and prepare these facilities for the opening in September.
For the safety of the learners.
For the safety of the... I'd like to start off by saying that being placed on quarantine should not be looked as a punishment. And a lot of information has been shared out there. I want to believe right now people are informed. in terms of why should you be put in quarantine, why are you put in isolation. And it is important for the general community to understand that the ones who are put in isolation are those who actually test positive. The ones who are put in quarantine are those who have had contact with the patients who have tested positive. And you do not want to take chances to release this person to the community and expose other community members to the virus. And you have mentioned the issue of Bill of Rights. It is important for us to realize that this response is being coordinated by the government. And the government, when at war, can apply mechanisms that it thinks is necessary to be able to protect the general population. So if the government deems it important to put you on quarantine to be able to protect the rest of the population, then I think they'll be doing the right thing. You'll realize that with the COVID-19, most of our health facilities are recording very low numbers of people seeking healthcare services because of fear. People are scared, but in that community, in the general population, we have people who have chronic illnesses. We have pregnant mothers who need to seek antenatal care services. We have children who need to be taken for immunization services. So my appeal, even as we move towards the end of this discussion, to the general population, in fact, let me say it in Kiswahili, ninahimiza kila mtu ambaye anaweza kuwa anahitaji kuenda hospitalini asikuwe na uoga. The government has put in place interventions to be able to protect everybody, but we are having that challenge where those people who have those illnesses, wale wengine wetu ambao wako na magonjwa kama hypertension, ugonjwa wa sukari, wako na cancer, wamama ambao ni wajawazito na wanafaa kwenda kwenye clinic, watoto wadogo wenye wanafaa kupelekwa wapewe chanjo. Hiyo nambari ya hao watu imepungua katika hospitali yetu. And on the other hand, unapata use of over the counter drugs. Watu wanaenda kwa chemist kununua dawa. Na ningependa kuhimiza jamii yote kuwa mwenye anasikia yuko na ugonjwa nyingine, ikwe ni malaria, uko na hiyo ugonjwa wa sukari, tafadhali enda kwa hospitali. Usikuwe na uoga kwa sababu ya corona. Kwa vile tumeona hivi karibuni kuwa nambari ya hao watu wenye wanaenda kwa hospitali imepungua. In terms of opening the economy, I would say it is the right thing to do, because with this COVID-19, I must tell you, there are so many people who have lost their jobs. There are so many businesses that have closed. There are so many people who don't know where to begin with right now, where to begin from right now. So in terms of opening the economy, just as I had mentioned earlier, given that we have experts that are guiding the government on what direction to take, like now they started off with the restaurants and the hotels, I would just encourage that, because so much is going on because of the impact of COVID-19 onto the economy. And what I like about what the government is doing, it is opening the different sectors in bits, which is okay. You can be able to monitor. When you open the hotel industry, what is happening? Because these are places where people interact a lot, isn't it? What are the cases? What are the numbers like when we open this sector? Then from there, if they find that the numbers are not going up, but are maybe
gradual,
they are going up gradually, or they are stagnant, then they can move to the next sector. And for me, I would just encourage that, because people are hurting outside here. People are hurting. People don't even know where to get their next meal. So if the economy can be opened in bits, And I also want to appreciate the government, because the government has also put in place some strategies to cushion people, though not everyone is being reached. Because like now when you talk about the tax exemption, then you'll find that a bigger percentage of our population are in the informal sector. So that does not actually affect them directly. So for me, I'd just encourage the reopening of the economy gradually.